The topic is evaluating analytical performance of the biochemistry test using Six Sigma metrics in a medical laboratory. The study was conducted under Dr. Aruna Pujari, that is the lab director, with the interns Sakshi, Sonali, and Vijay Kumar Rathod. So the whole purpose of doing this study was, first, as our discussions are always there, we always have a mental thought process that we'll publish at least one article in 1 year. So we design the study like that. Second, we wanted a study which helps the lab and also helps the lab to make the consultant or the clinician understand that whatever results we are giving are correct. Because when we talk to them about the internal quality control or external quality control, they do not understand that word. But when we say to them about the Six Sigma, this measure they understand very well, because the Six Sigma measure is used in various other industries and has been around from the year 1986. So let's introduce Six Sigma metrics is a quality tool used to evaluate the performance of a clinical lab. A Six Sigma process is one in which 99.99966% of the products manufactured are statistically expected to be free of defects. The study was aimed at using Six Sigma metrics to evaluate the analytical performance of a clinical lab by using IQC, internal quality control, as well as proficiency testing data of biochemistry tests. Now we are already doing internal quality control and external quality control or proficiency testing. So why do we have to do Sigma metrics? Because Sigma metrics is one particular measure that gives you the number of the errors. So we have a lot of data in the biochemistry lab or the immunology lab. So in these sections we have a lot of data. This data can help us to find a measure, that is Six Sigma, and finally help us in the quality improvement to give good results to the patient, obviously. Second, the most important, helps to reduce the operational costs. So if we see the Sigma chart, if there is one Sigma, if something falls under one Sigma, then there are 700,000 defects per million, and this is not considered to be good at all. So it is non-competitive capability. If it is called as 2 Sigma, so it is 310,000 defects per million, and this is also a non-competitive capability. This means it is also not at all good. 3 Sigma and 4 Sigma considered to be industry average. 5 Sigma has 230 defects per million and can be considered as a world class. 6 Sigma has 3.4 defects per million and is considered to be a true world class capability. So anything that falls between 3 Sigma to 6 Sigma, but not equal to 6 Sigma. So anything which is between 3 Sigma to 6 Sigma, but not equal to 6 Sigma, is acceptable. And anything which is equal to 6 Sigma and more than 6 Sigma is better, best, and has a world class capability. So, from the following chart, it can be inferred that as the Sigma score increases, the consistency and the steadiness of the test improve, thereby reducing the operation costs. Now, what operation cost would be reduced? That we are not repeating the test, we are not rechecking it again. The Westguard rules can be a little lenient. So, this saves the reagent, this saves the manpower, and this builds a lot of confidence in the staff as well as the entire laboratory and the patients and the consultants that we are giving good reports. Material and methods. The present study was conducted in the biochemistry laboratory of a tertiary care hospital from July 2021 to December 2021. The 6-month data of the internal quality control and proficiency testing were analyzed for the 22 different parameters, followed by calculation of 6 Sigma for each. Now, the parameters which were studied in the present work are as follows. I have given all the 22 parameters: albumin, alkaline phosphatase, alanine aminotransferase, amylase, aspartate aminotransferase, blood urea nitrogen, creatine phosphokinase, creatine GGT, glucose, lactate dehydrogenase, lipase, magnesium, phosphorus, total bilirubin, total cholesterol, total protein, triglyceride, uric acid, chloride, direct HDL, and iron. Now, If if you see this chart carefully, you will feel that I have not included sodium, potassium, calcium. There was a reason, and when we all came together, those who have done the paper, when we all came together, finally we decided not to include those parameters. The reason will come to later, but for now we will understand that in these 22 the normal parameters which are routine for biochemistry are not there, like sodium, potassium, and calcium. For each parameter, control materials were used at two levels. One was the physiological value, the other was the pathological range, and this was the internal quality control program. The data for the internal control assay was obtained from Vitro's 7600 analyzer. This is the analyzer that we have in the laboratory. On the other hand, the PT data was obtained from the Biorad ECAS program. Now, what were our tools? The coefficient of variation, that is percent CV, percentage bias, and total allowable error were our tools to use to calculate the Six Sigma score. The Sigma score was calculated for both level 1 and level 2 of IQC. Then the average Sigma score was calculated from the both the levels. Statistical analysis. Total allowable error or allowable total error defines the maximum acceptable combined imprecision and bias for a laboratory test result, ensuring it remains clinically useful and reliable. So, total allowable error has both imprecision and bias. Precision is repeatability, is the power of an analytical method to produce the same result of repetitive measurements made from the same sample, and it is being used to measure the random error. It can be determined from the calculated laboratory mean and calculated standard deviation. So percent CV or CV percentage standard deviation by laboratory mean into 100. Bias. Second is bias. Bias is the systematic difference between the expected results obtained by the lab test method and the results that would be obtained from an accepted reference method, which can be positive or negative. Bias was used as a representation of trueness. It was obtained from the ECAS program. So bias we have got from the ECAS program, that is the proficiency testing, and CV percent we have got from the IQC. Percent bias is lab mean minus group mean into 100 by group mean, and sigma score. Finally, the sigma score calculation is percent total allowable error minus percent bias divided by CV percent. Now we are getting everything from the IQC, means from the internal quality controls we are getting CV percent, from the external quality controls we are getting bias, and total allowable errors we will take from, in the following slide we will understand from where we are taking the total allowable error. If there is a poor sigma score, then another metric method termed the quality goal index is used, which assesses the relative extent to which both bias and precision approximate their quality goals. So its quality goal index is percent bias divided by 1.5 into percent CV. If it is less than 0.8, then it is imprecision. If it is 0.8 to 1.2, then it is imprecision and inaccuracy. And if it is more than 1.2, it is inaccuracy. Now we have to understand that for sigma score, now we need a percent total allowable error, one thing. And second is that quality goal index will be used only if there is a poor sigma score. What we considered is if the sigma score is less than 3, that is poor sigma score, then only the quality goal index has to be used. So let's go to the next slide. Now, sources of total allowable error. Sources of total allowable error can be clinical laboratory improvement amendments, that is CLIA, or it can be RCPA, that is Royal College of Pathologists of Australia, or it could be BVD, that is Biological Variation Desirable Limit. Now, this total allowable error is defined already by these bodies, and they are in percentages. Like for albumin, it is 10%, alkaline phosphate is 30%, alanine transamin is 20%. So all these are in percentage. So source of total allowable error is given by these bodies and these are in percentages. Now, when we were showing the 22 analytes, in that sodium, potassium, and calcium have not been taken into consideration because for these three analytes, it is in units. The total allowable error is given in millimoles. It's given in those units. It's not given in percentage. So if it is converted into percentage, then it will first of all we'll have to convert it into percentage, and it will actually affect the sigma score. So that is why we had not taken it, and I am telling it first hand only that why we have not taken it. We have also explained it in the paper that why we have not taken it, because it can make the sigma score either very low or either very high, because it is in units and not in percentage. So for for these 22 analytes, these were the total allowable error in percent. Now the table 2 shows the percentage bias obtained from proficiency testing, that is biorad. So for these 22 parameters, we have shown the percentage bias of July, August, September, October, November, December, and finally the last column is the average. So in average is around from, it starts from around, for chloride it is 1.7, and finally it is 6.1 for CPK. That is how different bias is there, percent bias in the different values of percent bias is there in the uh, table. Table 3, CV percent level of IQC of level 1 IQC. So level 1 IQC again all 6 months, and average is given in the last row. For albumin, the level 1 IQC average was 1.5, and for chloride it was 1.1. Table 4, CV percent level 2 IQC. Again, we have calculated the CV percent from the IQC because this is the second level of IQC. And again, the average has been taken of all the 6 months for all the parameters. Now now sigma, not 6, it is just called sigma. Sigma score level 1 IQC. So for albumin, the sigma score for level 1 has come to be 4.6 in average. Alkaline phosphatase, alkaline phosphatase 12.8, alanine transaminase 9.8. That is how, and chloride 3.1. And level 2, sigma, table 6, sigma score of level 2 IQC. Because we have 2 IQCs, then again 2 sigma score. Now the final table will be the average sigma score. So it is a 22 parameters, sigma score L1, sigma score L2, and finally the average sigma score. Here we can see that some of the analytes are above 6 sigma score, some are below 6 sigma score, but more all the analytes are above the 3 sigma score. So the study showed that out of the 22 parameters, 13 tests had a sigma score of greater than 6, while 9 had between 6 and 3. When the average sigma values were analyzed for 6 months, alkaline phosphatase, alanine transaminase, amylase, as AST, CPK, creatine, HDL, GGT, lipase, magnesium, triglyceride, and uric acid were found to be more than 6 sigma, and satisfactory sigma values, that is between 3 to 6, were observed for albumin, blood urea nitrogen, glucose, phosphorus, total bilirubin, total cholesterol, total protein, iron, and chloride. No test analyte showed a sigma score below 3. So the study showed excellent analytical performance of all the tests on the current biochemistry testing. Six Sigma or Sigma metrics is a very good tool to monitor the analytical performance of the instrument. And total allowable error is selected for monitoring. It helps in redesigning the quality control strategy. And also this sigma matrix, if the value comes less than 3 or between 3 to 6, it makes us, or it helps the laboratory to understand that we need to improve the lab personal training, give them training, train our own cells, and also It's very important that everybody at least once a year reads the SOP so that they know where they are standing and where the lab is standing. It was a great opportunity for us to publish this paper. Thank you so much.
Ma'am, and our journal, it's our moral responsibility to make our association's journal great.